What does COVID-19, cancer, acquired immunodeficiency syndrome, AIDS, and other communicable and non-communicable diseases have in common? It is not limited to any one country. Acknowledging the significance of the proverb, two heads are better than one, Guyana and Suriname has inked a landmark health cooperation agreement. This agreement will see the two nations helping each other by strengthening the healthcare services provided to their people. During the daily COVID-19 update on Friday, Minister of Health Frank Anthony outlined what this established mechanism will entail for the Guyanese and Surinamese people. According to the health minister, this unprecedented agreement covers all important aspects of health from both sides of the border. The establishment of services in the field of healthcare was signed by Guyana's acting Minister of Foreign Affairs, Frank Anthony, and Suriname's Minister of Foreign Affairs, International Business and International Cooperation, Albert Ramdin, at the Arthur Chung Convention Center. One of the major takeaways of the agreement is that Guyanese in need of specialized health care that is not offered locally can be sent to Suriname for treatment. It will be the same the other way around.
We might not have some of those services that they provide in Suriname and vice versa. So we have also come to an understanding that if we are providing those services, then the Surinamese can come over here and access those services. And if there are services that they have in Suriname that we don't have, then we would be able to send patients across there.
He pointed that currently in Guyana, there is a deficit in cancer treatment. As such, Anthony explained that those in need of specialized types of radiation can travel across the Suriname's shores.
Brachytherapy, for example, we don't have those services in Guyana. Persons can go over to Suriname to access it.
Minister Anthony explained that as part of the signed agreement, joint programs will come in the pipeline that will target areas such as research and disease control. He said that both health ministries are looking at the possibility of training of workers in the healthcare and public health services from both countries. And in the COVID environment, Suriname and Guyana agreed that they will collaborate and establish protocols on how they can regulate and control COVID-19 as well as other vector-borne and infectious diseases at their borders.
We have looked at cross-border health. How can we control vector-borne diseases such as malaria and things like that at our border? We have looked at infectious diseases such as COVID. The kinds of protocols that we should establish and how we can regulate people moving from one country to the other. What would those protocols look like?
In addition, Anthony said that both countries have agreed to regular discussions on how they can manage and control these diseases. Reporting for the HGP Nightly News, Amel Griffith.